Tshwane 2055.
The main activities that City of Tshwane can do to alleviate poverty in this area is really to give training, to train the community members to understand exactly how to get the gardens developed. There's not it's difficult to improve health of a community if the people are hungry, if they're underfed. So to assist the people of the community to be able to assist themselves with regard to food, that will assist a lot in this specific community. I do believe that if this specific approach of mobile clinics that can be moved after City of Tshwane built a permanent structure is the way to go, the way forward, to really take the healthcare services to those who cannot afford the transport to go to the nearest clinics. So my suggestion is that this model where we have a large mobile clinic that consists of 5 services: the mother and baby, the childhood development, lifestyle diseases, palliative and cancer. That could be replicated and be put as it is at another rural area that does not have services. Then it would assist a lot to improve the health of South Africa.
The setup here, it was meant to be temporary. We need a building because like today it's very cold and our clients are sitting outside, they are shivering. And then another thing, we don't have toilets, so we need a building where the facility is normal with toilets, water, and the place must be clean and well kept off.
The Tshwane municipality has assisted this project since the start. We are very thankful for the assistance with providing us with a site as well as vaccines, medication, and some medical equipment for the assistance with developing our administration. So they've already been involved to this clinic a lot. If you want to know where I see other places where they could assist us, it would be with some of our outreach projects, the Fund Day for the elderly. We also always need some assistance with those days. We also have an outreach project where we educate the daycare managers on health issues so that it's more on prevention, and there we focus on child diet, immunization, safe toilets, safe water, safe playgrounds, and we always need some support there, especially posters and pamphlets. And we also need support when it comes to water and electricity to the site, because that's our biggest problem why we cannot have medication here.
The hospitals are overcrowded with all the disease burdens, all the health risks that are coming from the community. Is there nothing that we can do as a government?
We're redressing the inequalities of the past, and the legislation is also there to guide us. So initially it was only married people who could qualify for houses, but now we realize that most of the people are working and have the capacity to afford. So let's give them the resources that they need to live in a city. Let's move away from that mentality of being employed. Let's be the employers. Can you see that now we're moving into 2055? We're not going to school to study to get employed, but we need to get education and apply that education to employ people. So we need to be providing employment ourselves without having to look into or wait for someone to provide me with the necessary employment.
But in essence, we are planning not for ourselves. We're actually planning for our future generation, so as to ensure that we anchor our ideas in the current situation, so as to enable us to have a sustainable future going forward.
I think if they could have been more helpful in maintaining the site. We are only here 2 days per week. Our time here is very limited, so we do not have time to clean the site and to clean all the weeds, so that would have been quite a big help. They do assist us with water and with extra toilets for our students, so the community are very involved in also helping this project.
Tshwane 2055.